In the last reporting period, 11,552 new coronavirus cases were recorded, putting the cumulative number of infections at 994,911. That's just 5,000 short of the 1 million mark. 245 people, have succumbed to the COVID-19 related complications. This takes the national death toll to 26,521. Recoveries currently stand at 839,194. Now, the health system is under severe pressure as admissions in hospitals are expected to increase over this period. Some hospitals are being forced to divert patients to other facilities. Unions representing nurses in Cape Town expressed concern over nurses under strain. For more on this discussion, we're joined by Dr. Anban Pillay, Deputy Director General in the Health Department. Doctor, welcome to SA Today. The grim milestone of the numbers I've just read out right now. As you said, you're not having any good time right now, festive season, but you're having sleepless nights thinking about COVID-19 and how to stop it.
Good afternoon to you and to your viewers. Yes, I think we're in the midst of a second wave or a surge, if I can put it like that, and I think it's kind of all hands on deck, and we really appeal to the public to adhere to the non-pharmaceutical interventions of mask wearing and social distancing, staying away from those parties and other gatherings. They're really driving up the infections, and as you can see from our hospitals, they're pretty much full. We don't want to get into a situation where we have more people than we have hospital beds, because then we're going to get into a catastrophic situation, and we really don't want to get there.
Now, Doc, all provinces with the exception of the Eastern Cape, I think a couple of days ago, continue to report an increase in the number of cases. KwaZulu-Natal, the Western Cape and Gauteng reported the largest increase in cases, comprising about 81% of the total new cases reported. Worrisome for the Health Department.
Yeah, the epidemic seems to be moving quite rapidly within Western Cape as well as the KZN. While the Eastern Cape is still very much at a high note, although we've seen a plateauing off in terms of the number of cases. There's also movement in Gauteng in terms of number of cases. Our biggest worry is clearly that there are many people that are on the coast currently that live in Gauteng and will be moving back, and as they move back, our concern is clearly that they may carry the infection with them, and that would then spread to Gauteng, which has a large population, as you know, and the spread of the infection within Gauteng is going to drive the numbers up even further and put huge pressure on the hospitals in the Gauteng area.
We've always spoken about the second surge, as it were, that it had greater deaths. If we look at Europe, particularly the UK and the US, we've seen that the second wave has brought with it more carnage, so to speak. Are we expecting the same here in South Africa, in particular now with the new variants that we've picked up along the way?
Well, it's interesting, Tavi. So if you asked many experts, a few months ago, they would have argued that the second wave will probably be lighter than the first wave, being much lower, etc., they thought, based on the assumption that there'll be higher levels of immunity, transmission will be reduced, and our numbers will be lower. But we're finding the direct opposite, and I think one of the biggest drivers of that is our behavior. So the number of people that are wearing masks now as compared to those that were wearing them in the first wave is clearly much lower. So many people have forgotten or have fatigue around the use of masks and the other measures to prevent the spread of the infection. And so the virus is continuing to spread far more rapidly and easily this time round than it was the first time round. And I think
yes,
the camera's on.
I can still hear you. Yes.
So the second wave has been far greater, simply because I think many people have not complied with the non-pharmaceutical intervention regulations that we have in place. I think if we did, we would have seen a much lower level of the second wave than we are seeing currently.
I mean, I hate using the term pandemic fatigue. At the end of the day, government, and I guess it begins with me as an individual, we must now plot and plan a way to actually get people back onto the way of things, how we did it, when we're all praising ourselves, patting ourselves on the shoulder, saying we're doing a good job. How then do we come up with interventions to get people to realize that, look, it's not too late, stay safe, social distancing, sanitize, what we used to do 5-6 months ago still applies now?
Yes, those measures continue to apply, and the very simple measures that will solve the transmission of the virus. In fact, if tomorrow every South African decided, I'm going to comply with this, I'm going to wear a mask, I'm going to social distance, no gatherings, etc., you will actually see a massive decline in the number of cases immediately. But sadly, we're in control of this, but we're allowing the virus to run havoc as such in our communities, which is very unfortunate and sad.
Let's speak about the health workers, Doc. I mean, the Western Cape had a chilling figure come out a couple of days ago. Their healthcare workers are not being spared. 761 health department staff in the province were currently infected with the COVID-19. 5 of them having passed away in the past 2 weeks or so. What does it look like nationally? Because, as you said, the numbers are rising and they're the frontline workers, and we've always said they will not be spared, in particular with the rising number of people with the second wave right now.
I think we must first salute all our healthcare workers who get up every day, and in the face of this, the epidemic basically, has put great pressure on the healthcare system, and our healthcare workers have come out to respond to every patient that's been infected. So I really think it's important that we salute them. Having said that, I mean, the health worker infections has largely mimicked the spread of the infection in provinces, either contracting the infection in the facilities where they are, and there are a number of risks working in an environment where there's high levels of COVID infection, or secondly, in the community as they travel home, being infected. So we really have to protect our healthcare workers, and we've indicated that the first group of people that will have access to vaccines when they become available will be our health professionals, given that they need to be protected so that they can provide a service to other South Africans who are in need when they're hospitalized.
I remember when the pandemic hit our shores, South Africa established, I think, 1,644 hospitals and quarantine centers to deal directly with COVID-19. Where do we stand now? We know a lot of those closed down when we saw the numbers decrease later on, I think just around August time here in South Africa. Where do we stand now? 1, 2, do we have the capacity? Because you can have all the facilities you want, but if you don't have the staff to man those, that counts for nothing.
Yes, so we've had to resurrect some of those field hospitals that we've established in KZN. They, for example, have been busy putting those facilities back in place to respond to the increased numbers. But the point you make is very relevant, that our healthcare workers remain a static number as such. And so they really are a rate limiting step in terms of the number of people we can potentially treat. So we've been moving staff around. We've been asking staff from the private sector, those that have been on part-time employment, etc., to come through and support us so that we can respond to this. Many have responded positively, and I think others will potentially come through as the need arises. But the reality is that we have a limited number of health professionals in the country, and we would have to use them effectively to respond to this pandemic. Again, I repeat, if we just apply the non-pharmaceutical interventions, we wouldn't need to get to this situation.
What do the numbers look like, Doc, compared to private healthcare workers and the public healthcare workers? Do we have a balancing act to play? I know a lot of people, I picked up on the socials today, some people saying, my medical aid, when is the vaccine coming? When can I go and get it? And I think where my question stems from is that it doesn't really matter whether you've got medical aid or not. When you get sick, COVID-19 does not say you are covered by such and such medical scheme. It's whether there's a bed available. What is a balancing act that you have as government to try and educate people to get help as soon as possible? Go to your nearest public facility where you'll most likely get the help you need.
Yeah, in fact, in some provinces, KZN being one, where you would find that the private facilities are actually closer to capacity than the public facilities at this stage, and so you probably will be able to get a bed in your public hospital. But having said that, it's important to seek care early. When you're infected with COVID, it's important that the clinicians start therapy early. When you present late, the complications have already stepped in, and the consequence of which is that being able to then prevent further complications is a problem. So we would really encourage patients to, please, as I said, are not as congested at this stage as private facilities, but that may well change as we move along with the pandemic in each province.
Dr. Anban Pillay, Deputy Director General in the Health Department, thank you indeed for your time, sir.
Thank you. Thank you very much.
Well, we continue this discussion on South Africa's COVID-19 cases further. We're now joined by Dr. Kgosi Letlape, who's a health activist. Dr. Letlape, welcome to the program. As we're speaking to Dr. Pillay there, the numbers look grim. We are in it right now as South Africans, and again, it's the health workers, it's people like yourselves who've been who are on the front line, who probably know better than we at home, who refuse to adhere to simple things like wearing our masks and keeping our distance.
Good afternoon to you and to the viewers. I think, as Dr. Pillay said, the key issue is in our behavior. The healthcare professionals can't stop COVID in the hospital. That's a place of last resort when you're infected. And stopping the infection is something that we do in our own capacity as citizens, and that is the key. And it should not be something that is forced on us by regulations or by the state president. We know what we need to do. Let us stop going to mass gatherings. Let us keep the family festivities to the nuclear family. Let us make this a COVID Christmas so that we can have more Christmases. So going to family should be like you're going to the mall. It should be on a need basis. And let's meet on the internet. Let's defer meeting physically. And we will have the spread of the virus.
I mean, if you look at the numbers, Doc, as of the 26th of December, yesterday, Boxing Day, South Africa had reported a total of 994,911 COVID-19 cases, falling just short of that million mark, a milestone. That is, there were 11,552 daily cases reported after two record increases of 14,000 per day on Thursday and Friday. So on average, we're recording around just under 11 or 12,000 cases per day in South Africa the past couple of days. This does not all go well. It seems as if we're back in June, July at the height of the pandemic in South Africa.
Yes, and the problem is that we're now into social activities of overcrowding. We're into the festive period. We're into the period where leisure activities are at a great height and people are congregating. So the virus will be extremely happy with our behaviors. If we don't change our December habits, we're in for a high. We will be beyond a million before the sun sets. And that will be a grim statistic to bear. And people should remember, it's not so much about what the health system can do. It's about what we can do. If we physically distance, if we wear a mask, if we avoid gatherings, even at a family level, if we defer leisure activity, if we choose a different holiday for this holiday season, where it should be a cheap holiday, stay at home, save the money, save our life, so that we can contain this virus.
Doctor, I think maybe we take it for granted, what you're saying, stay at home, you will not die if you miss the braai this week, but you could die if you go to that particular braai. And again, the question is the healthcare workers, the people on the front line, health activists such as yourself. The significance of those numbers and what it means psychologically and mentally to a healthcare practitioner who's sitting there and has to decide on who gets that oxygen and who does not.
Unfortunately, in our healthcare systems, we've been rationing ever since I've been in healthcare. When I started in my internship here which is way back in 1982, we had to ration care. When we had faction fights that were coming out of the single men hostels, we had to ration care. So rationing has been part of what we do. But what we now need to be doing is to ensure that the public helps us not to be rationing, because there's a public behavior that is directly related to the caseloads that we have. We also are in a silly season where the use of alcohol, the use of drugs, drunk driving, etc., increases utilization at hospitals. And all those things cannot be controlled by healthcare professionals. All these things are controlled by society and our behavior. And what I hope government will do is to accelerate the efforts of making the vaccine available. It would be a great boost to the frontline healthcare workers if the vaccine that is already available elsewhere was made available as soon as possible in South Africa for frontline healthcare workers and the vulnerable population group.
Speaking about government, a lot of people saying that maybe the president, in particular the SA Medical Association, saying maybe government should go to level 2 with stricter restrictions with regards to people moving around, because it's now a question of livelihoods and lives that South Africans are saying we do not want a tough lockdown, but the reality is the hospitals are suffering, the healthcare workers are suffering, something has to be done.
There is no healthcare system on this planet that can really be the front line for dealing with COVID. It's the backstop measure. It's the public that needs to help with dealing with COVID. So restrictions might play a role, but the key issue is the behavior of citizens. If we can't behave when we have less restriction, what makes people think that we will behave under greater restriction? We should all appeal to our humanity and bring back the spirit of Ubuntu, of caring for others. All that is going to happen with tighter restriction, it's to create a playing ground for law enforcement to operate on. And that creates its own problem. Let us, as family members, talk to each other, talk to our family, create an environment where we have the behaviors that will curb the infection. If somebody in your family wants to go and gallivant, go and visit somebody, talk to them, say, you can't do that. This is time for us to be here. So I hear where the association is coming from about the need for greater restriction. But the challenge is we are an unlawful society. And we need to begin to bring back the spirit of Ubuntu, of caring for each other and caring about others, and not being dependent on law enforcement for us to survive.
Dr. Kgosi Letlape, health activist, thank you indeed, sir. On that note, I think we can say thank you very much for your time. Much appreciated, sir.
Thank you. Please, physical distancing, keep away from gatherings. If you go out, don't be the one that brings the infection home to their next of kin. If you go out, quarantine, self-isolate, behave like you are positive so that you can protect the family and those that you love.
Dr. Kgosi Letlape, thank you, sir. Now, it's been a busy morning at Durban's main beach.